Dr. Forrest Tennant is one of the last doctors in America willing to treat pain patients using high doses of opioid painkillers.
I want you to take those two, and then I want you to take an oxytocin if we need to. Okay?
He operates out of a strip mall in West Covina, California, and he's contacted by patients from all over the country on a daily basis, pleading with him to treat them because nobody else will.
Physicians would get these patients dependent, high dosage, couldn't manage them, and then they would send them to me. And all that's happened in my clinic is an escalation of people desiring treatment for the last 10 years, up to where now we literally shut our phones off because they're filled by 9 o'clock in the morning.
But he may be closing his clinic's doors, which have been open since 1975, in a matter of months. When Reason did a story on Tennant's clinic in 2017, his patients spoke of how government restrictions on opioid use were causing legitimate pain patients to suffer needlessly.
Doctors have been closing their doors to chronic pain patients.
We're tired of the battle.
Many of us around the country have doctors who are being persecuted, and some are literally being prosecuted.
4 months after we ran that story, the DEA raided Tennant's clinic and home. The search warrant accused him of overprescribing medication and accepting payoffs from the pharmaceutical company Insys. Tennant has earned speaking fees from the company as recently as 2015, which he says is standard practice. And his nonprofit clinic regularly operates at a loss according to financial statements submitted to the Department of Justice.
I'd like to tell you it makes some money. Some years it doesn't make anything. In fact, we lose.
I really believe he saved my son's life. When the DA raided Dr. Tennant's clinic, I was really saddened because I felt that Dr. Tennant always did things the right way, and I couldn't understand why they were going after such a renowned pain doctor.
What was my reaction when Dr. Tennant's clinic was raided? I think the government's trying to kill me and every one of his patients. That we have no place to run.
The opioid epidemic.
Opioid epidemic with a lawsuit aimed against 5 major drug companies.
4 out of every 5 new heroin addicts in the country today started on prescription opioids.
Doctors that are prescribing incredibly high numbers.
We catch a drug dealer, death penalty. That's it.
Politicians and journalists often tell a story about greedy pharmaceutical companies that turn doctors into dealers and patients into addicts. And now we're told tens of thousands of Americans are dying of overdoses every year because of government inaction. But if this is truly an epidemic, it appears the diagnosis is wrong in a few major ways, and the cure prescribed by the government is making the disease worse.
When you restrict access to these drugs because you think some people might get addicted to them, that hurts lots of innocent people.
For 21 years, journalist Jacob Sullum has been writing about the suffering caused by restricting access to pain medication. And his April cover feature for Reason magazine examines the myths underlying the government's response to the opioid overdose problem.
Pain clinics are swamped by these patients who used to be treated by other doctors. Some of these people can't find treatment. Some of them are killing themselves.
People are starting to commit suicide at very high numbers. We know that people are going into withdrawal. We know that people are having heart attacks. We know that people are going out taking anything they can get their hands on and overdosing.
One thing they worry about is trouble with the Drug Enforcement Administration, which may end up investigating them because they look suspicious. Why do they look suspicious? Because they're treating lots of people in pain. People who may have been treated by other doctors and end up coming to the one doctor in the area who's still willing to treat them. And even if he does everything by the book, even if he's very careful, he does thorough examinations, he has their records, just the numbers that he's generating, and that will look suspicious to the DEA. All of this rhetoric that you hear from politicians and from the press saying, we have an opioid epidemic in America because of careless doctors.
We're identifying a lot of ill-mill doctors that are prescribing incredibly high numbers.
It's not starting on our street corners, it's starting in our doctors' offices and hospitals.
Most of the policymakers have bought into this idea that we doctors prescribe an opioid for our patients, who then rapidly become drug addicts, when all of the evidence suggests that this is not the case.
Jeffrey Singer is a physician and policy analyst based in Phoenix, Arizona. He has donated to Reason Foundation, the nonprofit that publishes Reason TV.
Study after study, including a recent study in January from researchers at Harvard and Johns Hopkins, have shown that patients given opioids for appropriate reasons have a less than 1% addiction rate. In the 70s and 80s and even early 90s, we doctors were way too stingy, and we were making patients suffer needlessly. I can remember countless times when I visit my post-surgical patients and I'd see them in obvious pain, and I'd say, have you taken the morphine that I ordered for you because you look like you're in pain? And they say, no, I don't want to get addicted. So we had this, what's called opiophobia, on both sides of the bed. But as we started prescribing it more opioids became in circulation.
Singer says it's a myth that most non-medical users start on pills prescribed by a doctor.
The source of these drugs is often the home medicine cabinet.
Studies show that many abused prescription drugs are obtained from family and friends, including from the home medicine cabinet.
The overwhelming majority of non-medical opioid users never go to a doctor or never had a medical encounter that introduced them to that.
Diversion is the primary route of opioids to non-medical users, which is why take-back programs exist. But the persistent belief that doctors are regularly turning patients into opioid addicts has motivated agencies like the CDC to set maximum prescription dosage guidelines, which were supposed to be voluntary.
I do not know of physicians who are going to be willing to prescribe high-dose opioids anymore.
I'm not too sure what Dr. Tennant is doing with me today, but I'm here because I don't want to die.
Gary Snook began seeing Dr. Tennant more than 10 years ago when his Montana-based doctors failed to relieve his chronic pain resulting from back surgery complications. Because almost no other doctor is willing to take Tennant's rare, high-risk patients at their current dosage levels, Tennant has decided to spend his final few months attempting to taper his patients down below the CDC guideline levels.
Whatever he's doing, I have to successfully go through it, so I can hopefully have a doctor on the other end that will treat me.
There are people who need those high dosages. They have a genetic pattern. I've done some recent genetic tests that show some terrible genetic variations, and I don't know how those people are ever going to get down to 90. There has been propaganda, and it's pure propaganda, that you can just stop opioids. You don't need to taper them, just stop. We're going to have some patients commit suicide. We're going to have patients that are going to have heart attacks.
Doctors in Montana don't take people like me. I don't have a doctor now. And there's no way that I'm going to be able to keep living without compassionate care.
Cigna and now Florida Blue.
This week, the maker of
OxyContin
announced it is ending its marketing operation for the powerful opioid.
In half. It comes as 13 states sue Purdue for deceptive marketing.
OxyContin hit the U.S. market in 1995 and promptly became the pill of choice for non-medical street users of opioids. Purdue Pharma, the manufacturer of OxyContin, was aware of its popularity as a street drug, a fact it allegedly worked to conceal. Yet the company also created abuse-resistant formulations which are uncrushable and can't be liquefied. By doing so, they were able to extend the drug's patent. With encouragement from the Food and Drug Administration, the company soon made all its OxyContin pills uncrushable. Singer says policies of this sort have profound unintended consequences.
The only thing they have done is just made non-medical users switch over to something other than opioids. And most of the time it's been heroin. This concept of abuse-deterrent formulations is not brand new. During the days of alcohol prohibition, ethanol was still allowed to be manufactured for commercial use. It was used in medications, for certain paints, for a lot of different preparations. And ethanol got diverted into the black market by bootleggers. So the government initially ordered that the ethanol used for commercial purposes be what they call denatured, with certain ingredients that would make it unpalatable.
But it's hard to stop determined consumers from getting what they want. People kept drinking the denatured alcohol, so the government went a step further.
They actually ordered poisons added to it. We know of at least 10,000 documented deaths from poisoning from people who drank ethanol. And Darkley, the director for the U.S. Treasury of that program, he said, you know, if some people die in order to have a more sober, alcohol-free society, then it's the price worth paying. I don't think for a minute that any of our policymakers today have that kind of attitude. But if they step back and think of what they're doing by promoting abuse-deterrent formulations of opioids, they're in effect doing the same thing that the alcohol prohibition people did. They're driving people to much more dangerous, deadly substances.
Despite the government's efforts, consumers continued to drink denatured alcohol, often at the cost of their own lives. Likewise, opioid users have continued to consume their drug of choice despite the government's crackdown on pain pills.
But this is the way prohibition works. I mean, prohibition makes drug use more dangerous to the extent that the government actually has succeeded in making pain pills harder to obtain. It has pushed people into a black market where the risks are much higher. The focus on prescription painkillers is especially misguided now that the vast majority of opioid-related deaths actually involve illegally produced drugs.
My name is Jillian Monda. I'm from Cleveland. I'm 28 years old, and I used to be a drug addict, but now I'm not. 2013 was a kind of rough year for me. I was sexually assaulted on my birthday. I kind of got a little bit too into just trying to escape that idea in the first place. Roughly 4 months after I was assaulted, I met my now ex. It started with us just like doing acid all the time and talking about life, and then one night it was, hey, do you want to try this thing? It's fun. It's not anything like anybody tells you it is. And I believed him, so I tried it. I hated it the first time because I didn't like nodding and feeling like I was gonna die. But the second time I tried it, I really liked it, and it kind of became a weird escape for me, and I feel like I never stopped after that.
Heroin, like OxyContin, is an opioid. Sullum says that victims of trauma like Monda or people with mental illnesses who are self-medicating are far more likely to develop an opioid addiction than our pain patients, who only develop addiction about 1% of the time.
It's appealing to think that you can solve the problem of opioid-related deaths by focusing on the supply of opioids. If you're interested in reducing addiction and the problems related to addiction, you have to talk about what are those factors that make this appealing. Why does somebody want to use heroin all day long?
Heroin is really good at making you not feel anything at all. It's not necessarily that you're just feeling really fucked up or really entertainingly intoxicated. It's really just that if you had any emotions about anything, things you normally care about, the longer you're on it, you just don't care anymore. I've always kind of had anxiety issues, and I found out that I had obsessive compulsive disorder. So getting sexually assaulted, I feel like it was extra hard when you have like your entire mental health is dependent on feeling like you're in 100% control all the time and someone else takes that control away from you. So instead of dealing with that in therapy like a healthy adult would have done, I just kind of shoved it down and pretended it didn't happen and like it wasn't that big of a deal. The one thing I've realized just between the people that I was hanging out with, people that I met in rehab, the big unifying factor was that everybody kind of had some kind of mental problem or thing they were trying to avoid or an issue that was kind of plaguing them, and rather than getting proper psychiatric care for that, they were just doing heroin.
Between 2002 and 2013, the number of heroin overdose deaths nearly quadrupled.
And they think it's being caused by a dealer or dealers who are lacing the drug with an elephant tranquilizer.
The frightening rates of overdoses are fueled by a mix of heroin and an opioid called fentanyl.
Not only has the number of heroin-related deaths gone up dramatically since 2010, but that increase is much more dramatic than the increase in heroin users. So this suggests that heroin is getting much more dangerous. And the most obvious explanation for that is that heroin is increasingly mixed with fentanyl.
In the beginning, it started with just hot pockets of fentanyl, like it was just little bits that were in your wrap. And sometimes you would get just an entire shot of fentanyl, which when the rest of your batch isn't fentanyl, your body wasn't expecting it or is used to it, so it made it really easy to overdose. But gradually it just sort of shifted into, you couldn't even really get morphine-based heroin anymore. It was just, everything was all fentanyl. It was all weird colors. There was pink stuff, there was purple stuff. It was just a really strange transition into everything being entirely fentanyl, and then how much stronger could they make the fentanyl?
This is what you see when you prohibit drugs. Drug traffickers will gravitate toward more potent forms of the drug. Black market drugs were always more dangerous than legally produced ones, in the same way that black market alcohol was more dangerous than legally produced alcohol during alcohol prohibition. If you ask, how can we reduce opioid-related deaths? There are several strategies that are very promising. They do not rely on eliminating the supply, because that has proven to be fruitless and counterproductive for over, well, a century now.
Cities like San Francisco and Oakland, California are at the forefront of what's called the harm reduction movement.
Harm reduction is at its core a pragmatic sort of way of looking at all risk-taking behavior. Access to opioid agonist treatment like buprenorphine and methadone. Access to interventions that are going to reduce harm from injection, like safer injection facilities, syringe exchange.
James Formo runs a syringe access program in San Francisco, which allows heroin users to turn in dirty needles and get clean ones in return.
We're meeting people where they're at, and we're arming them with information and tools to make better decisions to stay safe. We're also helping people stay alive long enough to make the choice to either go into treatment or stop using altogether. You know, it breaks my heart to hear someone say, oh, they should just die. Like, it'd be better off if they were dead, because there would be one less drug addict on the street.
And now San Francisco's Department of Public Health is preparing to convert some needle exchanges into safe consumption sites, where drug users can shoot up, snort, or smoke their drugs under supervision. San Francisco would be the first American city to allow safe injection sites, but Vancouver has already allowed the practice for years, and the U.S. Surgeon General recently announced support for the idea in America.
Studies of Insight, the supervised injection facility in Vancouver, and they all find there are positive health effects, reduction in overdoses. People worried that there would be increasing crime in the neighborhood. That didn't happen either. There are good data indicating that supervised injection facilities save lives.
This is one of those instances, like almost all harm reduction interventions, where the problem with implementation is not lack of evidence that it works. What we are battling is a moral discomfort.
And there's an even more radical approach than that of harm reduction. In response to its own overdose crisis, Portugal decriminalized all drugs in 2001.
They have a rate of roughly 6 overdose deaths per million population, as opposed to the United States that has roughly 312 overdose deaths per million population. When you end prohibition, you make it easier for people to come forth without fear, who want help, who want to get help with their habit or their addiction. And you also stop driving people towards dangerous drugs.
The DEA investigation of Dr. Tennant is ongoing. He's hoping to find another doctor to take over his clinic. If not, he'll close its doors by the end of June, and his patients, already turned away by their hometown doctors, will need to find someone else to care for them.
You can't just take somebody off opioid drugs and throw them to the street. When people get hopeless is when they think about suicide. And so I think we need to give everybody some hope. If nothing else, let them know somebody cares.
If you look at the practical effects of cracking down on opioids, the strategy the government seems to be pursuing, based on the results, is what you might call harm maximization. If it continues to do that to the exclusion of harm reduction policies, you're not going to see a decrease in opioid-related deaths, and in fact, they may continue to go up.